Hello, everyone. I'm Jim Ferris, and I'm the director of the Center on Philanthropy and Public Policy here at USC. So I want to, Kelly, it's been a while that we've been trying to get this together, and we're so excited to have you here for this conversation on philanthropy. It's been a lot of things that have happened since we started planning this, so we're delighted that you could join us today. And we hope to welcome you back to LA at another time, somewhere down the road. The Conversation on Philanthropy is a series that the center hosts where it has two purposes. One is to raise the profile of philanthropy, and the second is to bridge the silos that characterize philanthropy, like corporate philanthropy, family philanthropy, policy advocacy, what have you. And so the speakers that we've had in the series sort of spanned the range. And as you'll see today, in some cases, individually, they span the various domains within philanthropy. We're really looking forward to it, and I hope you are too. One of the silver linings of these extraordinary times is that typically we do these conversations in person, sitting down, often over lunch or coffee. And so with the pandemic and going remotely, we're able to welcome folks from across the country. So for those that haven't been able to join us before, we're delighted you're with us. And we welcome everybody near and far. So we're going to just get right into it. Kelly is the president and CEO of Arnold Ventures, which in a previous incarnation was the Laura and John Arnold Foundation. And so I think we ought to just start, Kelly, if you could talk about how you landed at Arnold Ventures. What is it like? What do you bring to it? What have you learned? Just sort of give us a sense of, what that world is like for you.
Great. Well, Jim, thank you for having me. Not quite what we expected when I thought I would be in person with you as you described, but I'm thrilled to be here. Like every little girl, I dreamed of working in philanthropy. Not really. I didn't even know what philanthropy was. And my path to Arnold Ventures was certainly not one that was scripted out from the beginning. But like most people I'm guessing on this call, I have been searching for a career that utilized my skills and strengths, but allowed me to do something that mattered and had meaning. My skills and strengths are really in business. So I'm a consultant by training and an MBA, and I've worked in a handful of corporate and for-profit settings, but always had a heart and a passion to do something that made the world a little better because of the work that I was about. So about a decade ago, I moved to Houston and was a part of a group writing a business plan to open an academic medical center here. And I had the good fortune of working directly with the board of Baylor College of Medicine, of which one of our co-founders, Laura Arnold, was on the board and the largest donor. And so over a handful of years, we got to know each other. As she and John were getting their philanthropy off the ground, they asked me if I would join and come and start new ventures. And it seemed like a great opportunity to do work that mattered in a way that was business-minded, that was analytical, that was data-driven. And so that's what drew me to AV, was really the desire to do meaningful work in a way that utilized my business strengths and my skills.
So, great. Go ahead.
No. I think the second part of your question was, what is it like?
Yeah.
Was that okay? We are a very serious place. We take the problems that we are aiming to address and to help solve really seriously. We're analytically focused. We're a data-driven organization. We're really composed of policy and research experts. We have lawyers on staff. We have business folks who try to tackle the issues that we work on from a number of different angles. We are about 110 people located. We're headquartered in Houston, but we have offices in Washington, D.C. and in New York City as well.
Have there been any surprises since you joined the group or the organization?
I joined Arnold when we were about 10 people, and we were focused on a handful of issue areas. So I would say, just as I feel like I've had the opportunity to grow personally here over 7.5 years, I've seen the organization grow and been surprised at every turn about the opportunities and the challenges. I think that probably the biggest surprise and opportunity that I've seen is just the opportunity that we have as philanthropists to do meaningful work in a way that so many other sectors don't have the flexibility and the freedom and the ability to engage. So we do a lot of government work, we work with nonprofit partners, we work with researchers, and every day I'm reminded of just how fortunate we are to sit in the seats that we do and to work with these incredible partners and to be able to think with them in the communities that we aim to serve about ways that our resources and our skills and talents can make a difference.
Great. So an important facet of the work here at the center focuses on individual donors and their philanthropic families. And so you're in this unusual, well, it's not unusual, but this sort of really interesting position where you're able to work with the living donors directly. You don't have to try and figure out what donor intent was. You can have those conversations with them. What would you sort of talk about what that kind of work is like? How does that shape what you do? You're not really dealing with a board of directors, you're dealing with the donors. So can you sort of give us a little bit of what that's like?
Yeah, it's certainly, I think, it provides a unique set of opportunities and challenges. Working with living donors gives you a chance to, as you described, understand donor intent in a meaningful and substantive way, and to evolve with that intent as, Laura and John, who I work with and for, as they grow and change, we as an organization can grow and change as well. I think that one of the biggest assets of working with living donors is that we can respond quickly and we can make meaningful changes or pivots as needed, because we don't have a set of parameters that were defined in a different time or when the world looked different. And so how does this manifest itself? For example, we really don't do relief work at AV. But given the pandemic and given the impact that the pandemic had on issues that we work on in the communities that we serve, literally the geographic communities that we serve, we made a game time decision to put a meaningful amount of resources into relief funding this year. And that's challenging to do when you're working with an organization whose kind of intent and foundation and boundaries were set before. And so it gives us this opportunity to be responsive and flexible and pivot and be dynamic that I think allows us to serve a specific role within the philanthropic community.
So that sort of, I want to come back to this issue about John and Laura. And obviously their sort of perspectives and passions and approaches to philanthropy define the enterprise, right? Can you talk about sort of what drives them? How do they see philanthropy working? I mean, you've offered up what y'all do as an organization, but if you could sort of talk about where that comes from personally, and from them personally, that would be interesting.
So Laura and John's intention from the beginning was to create opportunities and minimize injustice for everyone. And those are big, lofty goals that many philanthropic organizations have as well. But their point of view from the beginning was that we can't outspend the system's dysfunction, the policy problems, the issues that have made these problems endemic, multi-generational. We just can't outspend them. And so we have to, as our brand of philanthropy, think about ways to really maximize and magnify our ability to have impact. And so from the beginning, we have asked ourselves, how can we create lasting change at scale? And for us, that is about affecting public policy, because government has resources and reach that we as philanthropy could never have. And so from the beginning, Laura and John had this intention of working with government and nonprofit and private partners as well to create policy change that produces meaningful outcomes that improve the problems that we are all trying to address. And so we really are about, partnering to drive policy change at the federal, state, and local level. And, I'm often asked when I do interviews for insights into Laura and John. Strangest question I've gotten is, do they own cattle? And I guess people on either coast think that if you live in Texas, you must own cattle. Not true. But I'm often asked, okay, well, do you work on issues of healthcare because they had a family member, the Arnolds had a family member who couldn't get the care that they needed? Or do you, are you passionate about higher education because of some personal reason? And that's really not a motivating factor for them or for our organization. We really think about systems dysfunction, policy problems where government and private policy isn't producing the outcomes that it's intended to. And so that is the underpinning and the thread that you see across all of the work that we do.
Okay, great. So one last question about sort of the organization, and before we get into the actual work that y'all do, is y'all recently sort of moved from a foundation structure to an LLC. Can you talk about why y'all did that and what are the challenges with making that kind of transformation?
Sure. So, as I mentioned, from our founding, we have been about creating lasting change at scale. We believe affecting policy is a way to do that. And a couple of years ago, we were honestly looking at our ability to be strategic, to have impact, to drive systems level change. And we realized that if we wanted to affect policy, we needed to be able to strategically engage in political activity. And as a C3, you are fully encumbered and unable to use those tools in your toolkit. And so we made the decision to essentially move our people to an LLC so that instead of, saying, okay, look, I'm trying to solve issues of justice within the criminal justice system, but I can only do these certain activities, I can only fund these kind of grants, we can say what needs to be done in order for good policy to be known and to be implemented. And so that was the driving force behind our switch to becoming Arnold Ventures and operating as an LLC. The vast majority of what we still do, about 80% of our funding still goes to C3 activities. The minority goes to C4 activities. But having this freedom to think at a strategic level that isn't encumbered by specific rules that apply to C3s has been extremely liberating. I think the challenges with this sort of model, some are obvious, it's more expensive, right? I mean, all of our people and people-related expenses sit in a taxed entity and not in a nonprofit one, even though 80% of our work is nonprofit. But I think the real challenge is a brand and an image one. So we are asked at times, did you do this because you have financial interests? And that way, you can benefit financially. The answer is no. Did you do this because you want to be dark? Well, no, the answer is no. Actually, we have committed to publishing everything on our website, including our C4 activities, so that folks can see what we're doing. But that is a constant struggle when you operate under a different model, is that there is an assumption, and for good reason, that why are you doing that? What are we not understanding and what are we not seeing? So we are always looking for ways to be as clear and forthcoming and transparent with what we're trying to do, since we are operating under a different model.
Okay, so let's talk about the work y'all do. Y'all sort of are sort of trying to create policy change, systems change, and you use the phrase maximize opportunity and minimize injustice by investing in sustainable change building it from the ground up based on research, deep thinking, and a strong foundation of evidence. There's a lot in there. You want to try and unpack it a little bit. Obviously, you're looking to create change, but y'all have a different, y'all developed your own approach for what that means. And I just think it would be interesting if you could share it with the folks.
Absolutely. And I'll start by saying there's nothing, it's not rocket science what we do. So it's not like we created some approach that was this brilliant idea, but we certainly do have a point of view on what our type of philanthropy looks like. You asked me at the beginning, what is it like to be at Arnold? And I said something about serious and data and evidence, and that's really ingrained within everything that we do. And so from the beginning, when we decide that an issue area is something that there's a topic we want to explore, we dive in, we look at the data, we speak to experts, we talk to communities that we are aiming to serve, those who are impacted, and we try to learn and understand. And not just understand what's happening on the surface, but what are the root issues. And sometimes that process is months, oftentimes more of the time it's years. And I will say in the areas in which we work, we are still in the process of understanding what are the root issues that really cause the endemic societal multi-generational problems that we are aiming to address. But we do so in a way by looking at data, evidence, partnering, talking to experts, and coming up with a point of view on what are strategies that could be tested, what are questions that need to be answered, what are systems challenges that need to be explored and examined, and then we make grants against those. And we certainly have a philosophy that we are a funder more than a doer, and so we start making grants early, not only because we want to allow partners to do the important work that they are expertly skilled to do, but that is very much a part of our learning process is through grant making from the beginning. And so over time, we start to develop a point of view on what's the research agenda. So what are the questions that need to be answered for policymakers, nonprofits, and others to know how do we move forward in a way that produces outcomes that lead to meaningful change. So we quickly get to a research agenda. Over time, we develop a policy agenda, and these are the essentially the objectives of what our grant making is aiming to serve. And then we fund against that policy agenda at various levels of government. We fund directly with government. We fund nonprofit partners that work with government. We actually fund, we fund work that doesn't actually have much to do directly with policy at all, but we think that it's a part of the equation to driving policy change. And then, we have honest assessments frequently. Is what we're doing, does it make a difference? Is what we're doing what another philanthropy could do? Are there opportunities that we should be funding because we have living donors, we can move quickly, we're willing to make big grants, we're willing to make them quickly. We are trying to honestly and frequently assess whether or not what we aim to do is what we are actually doing.
So y'all have sort of focused mainly, not exclusively, in criminal justice, health, public finance, and education, I believe. Do you want to take any one of those and talk about sort of how y'all sort of develop the research, the policy, the trying to move change, just to bring it to life a little bit for folks?
Sure. So if you look we've been funding criminal justice work for about a decade, and we fund initiatives really across the spectrum, from policing to pretrial reform to corrections and community supervision to reintegration work. And if I brought any one of those topics to life, I think I'd pick community supervision. This is an area that we've begun funding reform and change efforts in about 2 or 3 years ago. We spent a solid year working with research partners, speaking to experts in the field, and these are, kind of scholars and think tanks down to, we went and met with parole officers, and we went and met with individuals who are on the front line really implementing the policy that is set at higher levels of government. And we, essentially asked and tried to learn, what is it that is helping you promote public safety, ensure that there is justice for individuals who are, within the criminal justice system, that are you using the resources that the government is giving for criminal justice reform as efficiently as possible. And then over time and through those conversations, we started to determine a point of view of where could we make a difference. And we realized that there were questions around what policy was actually effective and working, that there were practice questions of what, when it was implemented, actually produced the outcomes that were desired and intended. There was need for innovation and need for new models and new ways of thinking. And there was need for funders to come in and support that kind of different and creative thinking.
So in doing that work, do you have other philanthropic partners that you work with? How do you develop those relationships, not only with nonprofits, but and the advocates, but also with your peers, really?
So peers are critical, and there are, honestly, I wish we were even better at partnering with other funders, because it can be challenging to do. And I'm happy to talk about some of those challenges if that's a path we want to go down. But without a doubt, we work with partners, and we, become connected in a number of different ways. So it's through convenings, it's through conversation, it's actually frequently through grantees who say, hey, look, you should talk to this group. They're doing something very similar to you. It's through a number of avenues. And I think that is critical, that we find ways as funders to align and to have shared priorities, not only to maximize the impact of our funding, but then to streamline things for grantees who aren't being asked to do slightly different flavors of the same thing because different funders have different requests. And so that is something that I think is critical to moving this kind of work forward, but often challenging to do.
Yeah. So how do you, I don't know, as y'all think about sort of, different policy agendas, how do you think about whether you should be operating at the local level, the state level, or national? And then the other is, I noticed that y'all were involved with some California initiatives this last cycle. And how do you decide to do legislative or initiatives versus going to the courts or maybe administrative changes? I mean, y'all are clearly thinking, how do we intervene in that system?
Right.
Right. And it would be interesting to bring that to life a bit.
So that is very much art and not science, and a conversation we are constantly having, constantly updating our thinking. And the answers vary quite dramatically from one issue to another, right? Because while in criminal justice, there aren't an enormous number of opportunities to move things forward at a federal level, there are incredible opportunities at the state and local level. In our healthcare work, we actually are very federally focused because we believe that moving Medicare and Medicaid policy can have such enormous ripple effects on the sector that we choose to really concentrate our resources there. But how do we decide? I mean, it's in this consultation with internal experts, external experts, partners on the ground, our government partners. We have an advocacy team. So we have our issue expert teams. So we have the groups that you described who are policy experts, they're academics, they're researchers, they're practitioners who have deep understanding and passion for the issue that we work on. And then we have an advocacy and a political team who partners with that group to say, hey, look, it's not realistic. Nothing's going to happen here. We got to move on to other states. Or, we need to learn that this funding for this legislative activity wasn't effective. So next cycle, we're going to do something different. And so it is that constant evaluation through those partnerships, internal and external, that allows us to make those decisions. But we are always asking ourselves, is the tool we're funding the most effective one to have the best shot at driving impact right now? And I think you started the question by saying, how do you decide where you should go? And this is not the perfect phrase to describe it, but we will often talk about windows of opportunity. And so when you are looking to affect policy change, it doesn't matter if you have the great idea. It could be completely not viable for reasons that have nothing to do with the merit of the idea or the policy, but are about politics, are about the moment in time, are about, the fact that the world is focused on something else. So for example, we had a number of initiatives that came to a grinding halt in 2020 because the world was focused on the pandemic. And that's just reality. That's the nature of the kind of work that we do. So we're looking for windows of opportunity and saying what tools in our toolkit will have the best shot at driving impact right now. And I want to get to you had the specific question about legislation in California, and I'm happy to take that in whatever direction you want to go in.
Well, I mean, it was just, I mean, a lot of people from out of state don't come in state to do it. And I just actually was watching one of the advertisements on TV, and I just happened to see who was funding it. And you were one of several philanthropic entities in the state. And so I knew we would be talking. So I said, I'm going to ask her about it.
Yeah.
Because a lot of times people think about policy changes in legislative bodies, not through initiatives, not through administrative reforms, or even the courts. And it seems, from what I know, haven't studied y'all in great depth, but y'all have a bandwidth and a perspective that's very broad, where it reminds me of some foundations that will go to the Supreme Court to file an amicus brief, right? If it's an issue that's sort of central to their mission. And it seems not all foundations or philanthropic folks can do that. And y'all sort of, because of your scale and the organization you built up, can do that. And so I just think, y'all sort of, in some ways, can sort of implement this policy approach to philanthropy that a lot of people talk about, but seldom get there.
Yeah. Well, and we are still in the process of getting there. I appreciate the assessment, because we are certainly trying using many tools to affect policy change, but we are still very much in the learning process. I would say prior to getting to actual policy change, which we can talk about legislative, administrative, using the courts, et cetera, we do fund research and evaluation of what policy works and doesn't, because we think that no matter where the change is going to happen, policymakers need to know this is a bad idea. This money spent in this way will not produce the outcomes you are looking for. Or this is a great idea and we need to scale it, and we need to figure out what about this is working so that more states, more parts of the country can implement what is proving to be effective. Another piece prior to getting to the actual legislative, regulatory, et cetera, change is often innovation and piloting, and philanthropy is great at funding that work, where government may say, I would like to do something different, but I have what is that different program? What is the program that works? And so we will try to step in and fund pilots and exploration of ideas that then policymakers can pick up and run. But certainly the primary tools in our toolkit where we are directly going after making policy change are legislative. So, looking to work with state and the federal government to change laws. And those are highly effective and very hard to actually do, right? I mean, changing law can be complicated, time consuming, there's politics, there's all kinds of factors, but it has a very powerful impact. We work with regulatory agencies who have actually an incredible amount of flexibility within the rules under which they're governed and funded to do more and better with the resources that they have to produce outcomes and solve problems in a way that allows them to help communities. And so there are often agency solutions and regulatory pathways to creating change. We get involved in elections not only because elected officials set policy, so whether it's the district attorney, whether it's a governor, whether it's a member of Congress, that's a very important way to support policy change. But then, as you referenced in California, there are ballot initiatives. That is another way to change what is happening in an entire state, as it was in California, although we failed in the primary proposition that we funded did not pass. But there are all kinds of solutions in the electoral realm. And then you mentioned litigation, and I think that that is often an underexplored area of philanthropy. The courts have an enormous amount of power to interpret and affect change. And so we fund litigation efforts in almost every area in which we work. And it kind of flies under the radar. We might hear about the Supreme Court case that has to do with the ACA or has to do with gerrymandering or what have you. But actually, there are all kinds of decisions going to different courts all the time that are opportunities to affect policy change in a way that helps people.
So you have these 4 broad areas, and y'all sort of look for the windows of opportunity within them. How do you, if someone came up with an idea that let's add a 5th area, or we're not making much progress in one of these areas we've been investing in for a number of years, how does that conversation happen? And obviously you added an area largely, or whatever y'all did in the relief work because of the pandemic, it was sort of forced by the times. But sort of, one of the things that a lot of philanthropic organizations do is change what they do over time. And so it's not just whether you change or not, how long do you stay with something hoping that you're going to get success? And then when do you decide it's time to move on? Mm-hmm. And you're in you have the ability to talk to Laura and John about that with the support and the insights of your team. But I think that's one of the things, I think a lot of foundations struggle with. And, how long do you stay with it? Because these problems, especially on policy change, they're hard, they're messy, they're not linear, and so you have to have some judgment about what's the risk and what's the likelihood of success.
Great questions. And if anyone would like to type in the chat and answer, I'm all ears, because this is certainly, we are always thinking about, one, we're about long-term change, but when have you reached a point where what you're doing either isn't working or the issue has evolved to a place where the highest and best use of our resources and point of view is no longer needed? We are constantly reevaluating and asking ourselves that, while also recognizing that when you're aiming to address issues in the criminal justice system, in public education, you can't be a flash in a pan. You have to stick around, right? Like these are long-term problems that will require long-term solutions. And so this is something that we are constantly evaluating. And so we are committed to the areas that you described, but we are not married to the methods and the approaches that we're using within those areas. So for example, we just had a conversation this morning about our drug pricing work. We're probably the largest funder looking to reduce the cost of drugs so patients can get the care they need at a price they can afford. We've been doing this for 6 or 7 years, and we're at the point where we're asking ourselves, okay, are our methods as effective now, given the new dynamics in the federal government, given the new dynamics with the pandemic, et cetera? And so we are constantly saying, is what we're doing working, or do we need to adjust to be more responsive and to become a more effective funder? I think part of your question at the beginning, if I recall, was around exploration, and are you just sticking with the 4 areas? And I'm glad you asked that, because we have moved out of the startup mode. So back when I joined 7.5 years ago, everything was moving. We were 10 people. Every Friday we sat around a conference table and basically said, what'd you do this week? And that was kind of how we ran things, and we pivoted on a dime. And we don't do that anymore, and we shouldn't, because we have these commitments to these pillar areas. But we are led by living founders, and we have the ability to be responsive and pivot. And we think that that is an important asset we bring to the table. And so if we become static in a dynamic world that has dynamic problems, then we actually aren't living up to the highest and best use of us as an organization. And so we have a group that's dedicated to new ventures. And within that, not only are we exploring new topics, but we have nascent and narrower portfolios that don't necessarily merit the same sort of deep investment in team and resources, but there are issues and topics where we think we can go in with targeted funding approaches and affect change. And I think as a philanthropy, it's important to remember you don't have to pick one approach and apply that to everything that you do. And so as we become bigger and more established, we're trying to remain nimble, remain entrepreneurial, remain flexible, seek risk, because we feel that we can take on risk in a way that others can't. And so we're evaluating that within our program areas and as an organization as well.
Okay. Let me, there's sort of 2 areas that I'm particularly interested in, and maybe are under the radar screen. One is Civica, the nonprofit that y'all have been part of, or John has been part of, in creating a nonprofit to provide a supply of drugs for healthcare that are in short supply. And the other is sort of the support for nonprofit journalism, especially investigative reporting and sort of state capitals. These are sort of interesting areas, because a lot of times when people talk about policy and systems change, they're looking to government. And in these 2 examples, if you could sort of briefly explain them, and then why have y'all sort of moved in sort of creating nonprofit solutions in a way, and not looking to government? Is it a function of what the area is, and is that part of the new ventures that y'all are looking at, or sort of examples? I just am fascinated that they're not the traditional, let's pay for advocacy and coalition building and to move policy change. These are where you're actually doing things in a way, or enabling sort of the nonprofit sector.
Sure. I'll tackle each independently, because the rationale and what we are aiming to accomplish with those partners is unique in each situation. Mm-hmm. So, as I mentioned before, one of our major initiatives within our healthcare portfolio is working to lower the cost of drugs so that patients can get the drugs they need at a price they can afford. If you said, what's the one thing you could do that could have the most impact, I would say, let the federal government give Medicare the power to negotiate drug prices. That is politically pretty much a non-starter. It's very difficult. So in the absence of that, we are always asking ourselves, what are ways that we can put pressure on the system to reform itself, to make change? And it doesn't have to be a government policy solution, even though our end goal is really policy change, because we think that scales and has sustaining impact that no other solution could. We often look to other markets and other approaches to create that sort of change. And one of the problems within the pharmaceutical sector is that because of how patents are granted and the life that pharmaceutical companies are given to essentially charge prices that they would like for a drug, that creates perverse incentives, and it creates market dysfunction that has inflated prices and created this national major problem. We think that if there is a large scale or multiple large scale drug producers who don't have the profit motive, who are really saying, look, I want to get drugs to patients, I've got to break even so I can keep going, but I'm not looking to make money and line my pockets, that is another way to put pressure on the system. That forces those private sector partners to behave a little differently. It gives government an example of what the sector could look like when it functions more appropriately and as designed. And so Civica, that investment was made with those intentions, to put pressure on the system, to solve some market dysfunction and inefficiency, and importantly, get people drugs they need today at a price they can afford. The independent journalism work is, we think that in order for governments to work effectively, to do their job, to be accountable, to be transparent, you need journalism, you need journalists shining a light on things. They need to be in DC, they need to be in every state house, they need to be covering issues in local communities that matter to that community. And because of the economics and what's happened with the, so much of the journalism sector, we are seeing a lack of coverage of state houses, of local governments, and maybe not so much in Washington, but certainly in state houses and local governments. And we are about affecting policy change, and we think that there needs to be accountability and transparency in order to do that well. And so we fund independent nonprofit journalism outlets because we think it's an important public service and public good that contributes to the policymaking process.
Great. Anything else you want to sort of underscore about your policy systems change work before we sort of move on? We have about 15 minutes left, and I want to give you an opportunity to sort of reflect on the field of philanthropy. But we've talked about criminal justice. I was wondering if there's one area or one example where you feel really good about being successful or getting to an outcome that you're really pleased with.
I will highlight one of those little nascent small initiatives and portfolios that we took on about 5 years ago. So we fund a handful of initiatives targeting organ donation. So there is a high financial cost and a very high personal societal cost when individuals wait on a transplant list and they don't get the organ that they need. It's, as I said, it's costly to the healthcare system, but it's tragic to people, to families, to communities. And we have been working with a handful of partners over the last 5 years to look at the system and to figure out, okay, wait, we actually have enough organs, really. Why are they not getting to the patients who need them? Why are there these perverse incentives that create these inefficiencies that cost us money and cost us lives? And it's a small but mighty group of grantee partners in the field doing this work. And they very recently had a major success, major success, the federal level, to essentially reform the organ procurement organizations, the rules that govern how organs are given to one person and to another, and how that whole process is overseen. And it was awesome to see these small nonprofit partners, these researchers working on something that's so easy to not notice, that has that personal and financial cost, and then to see their work manifest itself in real policy change that I have no doubt is going to save money and save lives. And so, it's a small example, but it is such a tangible one. This group of probably 10 different organizations, not that many, created national policy change that people are going to live from. And I find that so exciting and so inspiring.
Yeah, that definitely is. I'm just sort of taken with your description of markets and systems. It has a depth to it, which probably reflects all the work y'all have done. So I want to sort of shift a little bit and talk about your impressions of the field of philanthropy. Sort of what are the opportunities beyond just what Arnold Ventures do, but so you've been in the field, what, about 7.5 years, I think you
Yeah.
said.
Mhm.
And yeah, so you've had a chance to observe, experience, sort of what's the opportunities you see, and then I don't want to end without giving you an opportunity to sort of share some frustrations or what are roadblocks and any thoughts about how to overcome them. So let's just have a short conversation about philanthropy
Yeah.
writ large.
Well, first of all, I did not dream about working in philanthropy when I was a child, but I have come to appreciate that philanthropy is critical. Like, we are the backbone of so many things that are good and right and aiming to make the communities in which we live better, and better is particularly for people who may not be able to do that for themselves. So I'll start by saying I actually have an admiration for our field, but I think that there are opportunities to ask ourselves questions. The first of which I would say is, there's not a lot of accountability. So as someone who comes from the private sector, it is odd to work in a field where there are very little results that you have to produce at the end of the day. And I don't think that's a bad thing necessarily. I think that actually gives us the freedom to test and pilot and take on risk in a way that government can't, in a way that the private sector can't or won't. But I think it puts a responsibility on us to constantly ask, is what I'm doing, does it matter? Is what I'm doing is it creating the most impact that I could? Or do I need to be really honest with myself and say, yeah, no, this isn't working. We got to change course. We've got to do something different. So that lack of accountability puts a responsibility on us, which I think is important. Second, and this is something that we talk about a lot at Arnold, and I think it comes back to having living donors and recognizing we can do things in a unique way. But what is the unique role that your organization or your type of organization can play in the field of philanthropy? So we will often ask, could someone else fund this? And if the answer is yes, and they probably will, we often don't make those grants, not because they're not good. They're actually often great grants. But we think, if somebody else is going to step in, let's do the thing that we are uniquely suited for that someone else can't or won't. So I think in addition to the lack of accountability requiring responsibility, we have to say, like, what is our unique role? And am I really committed to that? And am I making sure that everything I'm doing is in line with that unique role? And then finally, and this has actually been something that we are working on, it's engaging in a meaningful way with the communities that we serve. And so it can sound like lip service, and certainly in 2020, for groups like ours that work on issues of race, this has become a big topic. But it has been something that we have been thinking about for a number of years because, I'm sitting in an office in Houston. I am not in the communities that we are aiming to serve and partner with. And going on a site visit is nice, but it's not the same as engaging in a meaningful way with those communities. And that's hard to do. We are still figuring that out. But I think that is something that, as we as a field can do better than we have.
Yeah, I think there's a lot of movement in that direction. But so let me just sort of go back to this idea of you want to do things that you uniquely can do. But if you have that stance, then how do you find the room to partner and collaborate? I mean, that's part of, I think, the tendency of philanthropy, especially more traditional. It's very much this foundation does this.
Mm-hmm.
And So there's an identity, a brand associated with it. When a lot of times what you need for success is to be able to scale up and get a lot of partners behind an effort. So how do you decide when y'all can sort of move on your own and when you decide you need to work with others? I'm not talking about nonprofits in the
Yeah,
community.
no, I understand what you mean. And I should say, when I say what are we uniquely situated to do, it's not from because it's ours, it's an AB thing, it's our brand. It
Yeah.
is, we have living founders who are looking to spend down their assets in their lifetime. We can make decisions quickly and we make big grants. Those are kind of the unique funding attributes. And so it's less about like, oh, this will be our unique thing, but more about, does it needs a philanthropy or a group of philanthropies that can do those things? And that's more of what I was describing, and less about like it's ours and not partnering with others. I wholeheartedly agree with you that there are plenty of initiatives that need lots of funders for scale purposes. They need it for credibility. They need it for whatever the reason may be. And we fund those and happily. But I think those fit within our unique spot. I would argue that actually those meet those requirements, if that makes sense.
Yeah, definitely. I mean, if you look back over the last 20, 25 years, there's been a lot more collaboration in philanthropy than before. And I think there's a realization you can get further together.
Yeah. And well, it can be challenging. I have never encountered an organization that did not want to really attempt to partner or share information or be helpful. So I think as a field, there can be reasons that it's challenging, but at least from my 7.5 years working in our sector, I have yet to meet a group that says, yeah, no, thank you. We don't want to deal with you. So I think that there are practical reasons that often hold us back. Many of them we can overcome, but I have yet to see a lack of willingness to partner.
Yeah, but it's not easy, right? No. I mean, that's the route. I could think of a lot of things to ask you, but we're at the end of the hour, and so I don't want to keep you. But I'm just sort of struck by the work you're doing in policy, which when we started the center 20 years ago, there were not that many people talking about policy or systems change. And so I think in some ways y'all sort of epitomize how the fields really move. And so it's really refreshing and makes me feel good about the field. How do you feel about philanthropy? Say, this is the last question for you. Like in the next 10 years, where do you see philanthropy going?
Oh man, you're going to end with a really easy one. The groups we often work with are ones like ours, where we have living donors. We are looking to affect systems level change. And I use that word really loosely. I actually see our field digging in and doubling down on that. And in a way that is going to be important because, we have the opportunity to really meaningfully address so many of the issues that I know people on this call dedicate their life to. And I think that we're at a bit of a pivotal moment where my guess is over the next decade, there's going to be a lot more groups who are saying, I'm all in on this. And I am all about systems change. And I am willing to go deep on this issue. We actually are encountering fewer organizations that are spreading themselves pretty thin. And I think that if anything, I feel like I'm having more conversations about going deep and hard and long on things than casting a wide net. And so I'm optimistic that this approach to creating lasting change at scale, to using policy to affecting systems, is something that more organizations are using as an approach, and that will, I hope, produce great results. And I hope, going back to where we started, I'm guessing most of you guys want to do something that matters and that the world looks a little different and better because of the work you and your colleagues did. And so I'm optimistic that if we're having this conversation in 10 years, we'll have more of the organ donation success stories to talk about.
Well, yeah, and that's a great way to end on an optimistic and hopeful note, because there are, like you said, there are many opportunities for philanthropy. And so sort of thank you for sharing your experiences and perspectives with us. And when we're able to travel again, we want to get you back out here, get you out to LA.
I look forward to it. And thank you, everyone. Thank you, Jim and Greg and everyone for making this happen. And everybody on the call, I wish you all the best. I wish you all the best personally and in your professional endeavors. So thanks, everybody.
Thank you.
All right. Take care.
Bye.
Bye.